Hi, I'm Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visa liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Okay, I want to talk about gynecomastia and its link and its risk of cancer. For most patients, gynecomastia, especially 90% of patients, the cause is what we call physiological or normal issues that lead to hypertrophy of breast tissue causing gynecomastia. But in some cases, they are more serious. There are certain linkages between gynecomastia and cancer, and I would like to delve into it to raise awareness of patients who could possibly be affected by this condition so that they are aware of it and can be screened more for it so that this patient can be treated as well. So first of all, I think a lot of people do not know that testicular cancer can be often presented with various symptoms, and breast enlargement and gynecomastia is one of them. A study has indicated that 10% of testicular cancer first presented with gynecomastia or breast enlargements. So in all of our cases, we usually do screening of breast examination, investigation, ultrasound to make sure that we don't miss all these organic causes. But what I would like to bring attention to is male breast cancer. We often talk about breast cancer for female, but male breast cancer is actually possible too, although it's extremely rare. About 0.2% of all male cancer it's caused by male breast cancer. But even then, we do not want to miss these patients. So male breast cancer can present like a female breast cancer symptoms, which is enlargements, pain, discomfort, discharge, skin changes, or hard firm nodules around the chest or the armpit. Patients who are presented with gynecomastia, we typically go through all these examinations and investigation to make sure that these are important things to exclude before undergoing any treatment. It's extremely rare. Based on my 20 years of experience treating gynecomastia, we kind of pick up a few cases with high risk of carcinoma in situ, which means that precancerous state patients would normally, with no symptoms at all, coming in for treatment for gynecomastia. I still remember clearly a young man in the late 20s with gynecomastia breast enlargements since teenage years, and perfectly asymptomatic except maybe just breast enlargements, a bit of irritation, feeling discomfort very close and such, which is pretty common for most patients with gynecomastia. All tests examination yield negative results. There are no signs of risk of any underlying organic causes. But however, after surgery, which we typically do send the excised breast tissue for histology to make sure that the breast tissue that we took out is normal and no underlying further actions need to be taken. But I still remember this case where we finished our surgery, everything went smoothly, and the biopsy histology came out to be precancerous state. So it came to a shock for us, for the patient, and for the patient's family as well. And his mother is a nurse. To them, it's actually a shocking news that son, which is healthy, no risk factors, presented with precancerous state of the breast tissue. And of course, we talk to the patient, we counsel the patients, and we send him for tertiary care, tertiary referral in the hospital for follow-ups. Luckily, the patient is in stable condition. There's no further progression so far that we have heard from him. Everything is under regular monitoring and follow-ups. So it's actually good that we actually pick up this surgery because he's in a precancerous state. If this is left long enough, there's a risk that it may actually turn cancerous and lead to something more serious. So the reason why I raise this is because for sometimes any kind of benign looking, even gynecomastia, if you're not too sure about it, you need to seek medical attention, medical treatment to make sure that even though the possibility is low, that we want to make sure that these are the risks that we want to exclude. And there are often literature that we can refer to that incidental finding of breast cancer for patients coming in for normal gynecomastia review, gynecomastia surgery. So all in all, early action matters. For men struggling with gynecomastia, should take this medical condition seriously. Do not dismiss it as just fat or bad genetics. Speak to your doctor and take charge of your own health. Thank you for listening. If you have any questions, just email us. See you again.